Alright, so in this video we want to talk about how we would work with a patient with unilateral involvement, getting them to the toilet. So this is a patient who is able to do some things by themselves. They're progressing on independence, so it's not a full max assist transfer, and we're trying to help them regain some function. So first of all, we need to know the makeup of their bathroom. Where's their toilet positioned? In our bathroom here, the toilet is positioned over here on the left-hand side, but in some patients, maybe their bathroom is over here on the right-hand side. And so even in our clinical arrangement here, we could simulate that by using a porta potty or something like that, or at the very minimum, we could put a straight back chair there and practice how to transfer to a straight back chair if her bathroom setup was different. So think about how we can be creative to simulate the environment for the patient in your clinical site. But in this case, we'll just imagine that Dana's bathroom is set up much like our bathroom here. Again, we point out the things that there's grab bars here. This would be important to recommend for the patient for home use. So we might ask them about that, or if we're physically in their home, we might make suggestions for that. We should not be applying those grab bars in the patient's home. That should be done by a licensed contractor. So please don't offer, or if the patient asks you to do that, please decline, because it makes the clinician liable, and we don't want that because we're not contractors. Okay, so Dana, which arm do you want to be involved today?
We'll do my left.
Okay, so she's going to have left side involvement, so her left side is involved. So we're going to need to get her up into this bathroom, and so we're going to move her relatively close. If she had left side involvement, most likely her right side would not be on the wheelchair. So let's take this leg off, because she would already be wise to using that for propelling herself and manipulating herself around in the bathroom. So what we're going to do is get her reasonably close. She has her gate belt on, so get her reasonably close. And now we're going to lock your brakes, so we know we've been practicing those things. She might need some brake extensions. Alrighty, let's use the hook method to get this foot off there. And now we'll fold that up and get that out of the way. So we can remove it if necessary, or just get it as far out of the way as needed. So now our rule is that we always go to the strong side. Well, our problem with Dana today is that her involved side is the side closest to the restroom or the toilet. So she's going to need to do the long way home. She's always got to follow her rule of going to the strong side. So in order to do that, she's going to have to come to a full upright position and then turn all the way around to get to the bathroom. So what we're going to do with her is, first of all, Dana, in order to get out of this wheelchair, it's going to be easiest if you slide forward. So she slides forward. We're going to stand in front of the patient to help. It looks like she's already had some familiarity with how to push herself up. So on the count of 3, we're going to stand up. We support her as necessary. She's going to then take this arm and bring it forward to the bench or to the rail. And now she's going to start to turn. Turn, 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 turn. As she comes around, she can use that arm to either reach over here or behind her, whatever's going to work best. And now she can lower herself down to the stool. Now, in the process of doing the turning, before she sits, she's going to have to undo garments. So if she has sweatpants on or yoga pants, she can slide those down. But somehow she's going to need to be able to manipulate that before she gets to a full sitting position. Maybe even in the chair before she stands, if she's got blue jeans on, she might unbuckle or unbutton so that they're at least loose. So when she gets over here, she can do that. Once she's here and safe, if she's stable, then we can step out and give her some privacy so that she can do what she needs to do. And once she's done, if she needs assistance, we'll guide her through that process or help her with whatever areas she needs help with. But once she's done, then we'll help her get her slacks back up. And now as we come forward, Dana, what we're going to do is we can use your your armrest here. We're going to come again to a full upright position. When you're ready, 1, 2, 3, up. And now her strong side is going to be this short way home. So she's just going to reach across, turn, and sit. If the roles were reversed, if this was the involved side and this was her strong side, she would simply slide forward, come forward and up, reach across, and sit, taking your slats down here. Okay, and then when she was finished, when she came back up, now would be the long way home. Go forward and up, come toward me, reach across, keep turning, and down she goes.